Hi there. So again, my setting is an enhanced therapy clinic, dealing with the outpatient population. I think in the professional understanding of the environment, um, because I'm working directly with individuals whose work ability has been majorly compromised and their living environment has been compromised because they're no longer able to do their everyday chores. I think professionalism is incredibly important to be mindful of. In some of the readings, Davis and Rusty, that was that professional behaviors um, include taking initiative and being a dependable caretaker or professional caretaker, showing competence, especially empathy for the individuals, integrity, and finding some way to cooperate with them. I have to remember to put myself in their shoes and realize that they're under an incredible amount of stress, and that if they encounter a situation where they're saying like, "I'm worried I'll never get back to work," um, I have to remind them that I understand their concerns and I help talk them through the challenges that they might face and the reality of the timeline, and specifically that some things don't necessarily come back instantly after surgery or after an injury. It just takes time and effort, and that we may only see them for a short window of that time, but they have to continue to do these things on their own. And so you have to explain to them the medical side of things, but also um, the reality that they're going to face, but also encourage them in some way. It's like, for lack of a better phrase, I think it's like being a little league coach. Um, I've been very lucky at the therapist at my fieldwork site. They've been very professional. I haven't really seen any situations where I've observed unprofessional behaviors. It's more of that we do discuss these things after the fact so that we're aware of how to avoid these pitfalls. So, for example, if someone says my exercise is uncomfortable, I don't just say, just keep doing them. I talk them through it. I help communicate uh, what our end goal is and what, being patient and understanding and having grace for themselves. Um, and also, I constantly, even though I might see the people over and over, I constantly remind them, if you have any questions, don't hesitate to ask, because that's literally what I'm there for, is to walk them through the exercises, walk them through the recovery process, little by little. Um, and I think that's how, in some ways, I have to remember that this semester has challenged my own growth and my own professional growth. Dealing with my chronic back injury, I'm having to understand to give myself grace, and that I do have pain that I deal with, and so in some ways it helps me connect with the patients in a deeper level. I would say. Um, so it's also remembering how to communicate effectively and having accountability and continuing to learn despite any of my what I might perceive as a setback. It's like, don't give up, just keep pushing, just keep trying. That it takes time. Um, and then one concept that connected with my experience was that, again, being a professional involves being dependable and having some level of self management. Um, because when it comes down to it, even though I might have a field worker help me through some of my understanding and communication and like digesting each day at the end of the day, it really comes down to managing my own educational approach and like, educating how I perceive things and how I'm able to digest the information to a point where I can actually become a more proficient student and then down the road professional. Um, and I realized that it's not about avoiding the stressful situations; it's learning how to manage any of the stressful situations. So, like, again, at the end of every day, my field work supervisor and I, we sort of sit down and talk about everything. Even sometimes after difficult patients, we discuss everything. And so it's like, okay, what did we learn? What could we improve? Do you feel like there's anything that you're struggling with? And I think he's actually pretty cool in that aspect, that we I don't know, I think we're able to connect and understand things as beyond just the sitting at the table working with someone scenario. You're understanding things beyond the work environment. So things, and in some ways that way that we discuss. So I think like having a lack of accountability, being dishonest, poor communication, or blaming even my coworkers or patients, my co-trainer people. I think that would be an unprofessional approach, and so that would actually make me a bad student. And so I try to avoid those things. I kind of like I constantly have those things cycling in my thoughts. Um, and this also is because the environment. Many people are under an incredible amount of financial stress, and the injury affects their workability. So I have to remember to be patient and calm and collected. Um, and that's it. Thank you.